In the past, cosmetic surgery was thought largely to be the domain of wealthy, aging women. That's no longer the case. Meet Helen Dunn. At 24, she's decided to have her face and body recontoured in an afternoon. Each year, millions of people around the world have cosmetic procedures. In the past 5 years alone, the numbers have increased over 150%. But beauty has a price. Tummy tucks, thigh lifts, breast implants, liposuction, and facelifts can range from $2,000 to $5,000 each. What's driving this willingness to open up the checkbook or hand over the credit card? The baby boomers are getting old, and they don't like it. In the 21st century, will aging as we know it exist? Or will advances in cosmetic surgery make the aging face and body a thing of the past? If there is a national epicenter leading the trend towards this youth culture, it is no doubt in the land of sunshine and movie stars, Southern California. Doctors Grant Stevens and Brian Kinney, both aesthetic surgeons in the Los Angeles area, know all too well the impact of the media on their business.
This is a tough town for people who are concerned about their appearance. Not only is this town driven by youth and the youth culture, but the pursuit of perfection here is as high as it is anywhere.
One of the first jobs of any competent cosmetic surgeon is to help the patient decide what is reasonable.
A patient who wants to have the change done immediately, who has only wanted to do it for the last few days or weeks, in other words, the duration of time they're thinking about it, that wouldn't be a good reason to have a life-altering or facial-altering procedure. We want to know this is something that's been bothering them for a certain period of time.
Most doctors would agree that a well-informed patient is the first goal. And the advent of the Internet has had a powerful impact on everything from answering the basic introductory questions to the important decisions on which surgeon to use.
The Internet has leveled the playing field. People from all over the world can obtain information about a subject that up till now has been sort of difficult, sort of mysterious for some people.
Over half of Dr. Stevens' patients visit him on the web first.
Patients are welcome to the web page and are offered various possibilities, including picking a procedure that they might be interested in. And once they've found the procedure, they may then learn about it and subsequently actually view before and after pictures that would show them what they might look like if they were to have this procedure.
There are two basic kinds of aesthetic surgery, those intended to redesign a person and those that fight the signs of aging. Each year, more non-surgical techniques are added to the list of weapons against aging. It's a war that might be summed up in one word: maintenance. Walk through the door of Grant Stevens' office, and it's a bit like walking into the future of cosmetic enhancement. Here, surgeons, dermatologists, and skin technicians work together in the battle. Most cosmetic surgeons agree. In the future, the fight against aging will begin when we are young. The first step? Basic skin care procedures to prevent the wrinkles from forming, which might include exfoliating skin, that is, removing the top layer. This dermaplane is basically a straight razor. The latest wave in exfoliation is the chemical peel, of which there are many varieties. The weaker chemicals may be applied by a technician, while the stronger solutions require a dermatologist. For the slightly braver age warriors, there are even more high-tech weapons. Perhaps the most bizarre involves injecting botulism into the frown muscles. BOTOX is a medically used derivative of the botulism bacteria, which in larger doses is poison. Dermatologist Molly Griffin says there's been a rapid increase of interest in simple procedures such as this.
I'm about to inject this patient with botulinum toxin A, which is the same as BOTOX. Deep scalp for me. Good, okay.
The BOTOX begins working in the days following injection. It can be effective for several months. During that time, as various facial expressions are made, those muscles that repeatedly furrow the brow are motionless. No longer subjected to constant creasing, the skin doesn't wrinkle.
3 days, and the full effect is about 7. It's a very strong toxin, so we use a small amount of the toxin and we place it locally. And you only get the effect locally in the muscles. There's no systemic absorption of Botox. I tend to use Botox on the lateral eyes for the smile lines and for the squint lines, for the scowl lines between the eyes, and horizontal forehead lines. When you lift your eyebrows, you can see the horizontal forehead lines. It can also be used on the neck for the lines that some people get from contracting this superficial muscle right here.
There are potential complications, namely a condition called ptosis, in which the paralysis travels to unwanted areas, leaving the patient with a short-term lazy eyelid, for example. For many, the small risks are worth the gains.
I like the fact that you can get small things done without having to have any cutting or having it obvious that you've had any kind of surgery. So you just look like maybe you're well rested, you look like you just look great for your age, that you've kept out of the sun all these years, and really that's what it's about, taking care of yourself.
Although Botox is an active ingredient, much of the current focus regarding injectables is about finding better substances that can be used in contouring. Even with something as simple as removing a line, there are risks. And as we enter our 30s, the lines will inevitably deepen. Then one might step up the battle with an occasional laser resurfacing. Until recently, the only lasers used in resurfacing were so powerful, they required a trip to the OR and weeks of recovery before the skin was healed. Incredibly, this cool touch laser affects the layer beneath the skin surface, promoting collagen. The laser is not the only futuristic thing in this scene. So is the gender of the patient. Lars Isaacson is in many ways typical of the male patient wanting cosmetic surgery, a middle-aged professional competing in the workplace with much younger men. Male aesthetic procedures have increased over 100% in the past decade. Experts predict the trend has barely begun.
I've personally seen a dramatic increase in the number of men having cosmetic plastic surgery. During the recession in the early 90s, I had a number of men tell me that they were wearing their resumes on their faces.
I think appearance has always been important to a lot of men, and I think that just like the boom in the workout phenomenon, you go to the gym partially for health, but also because you want to look good. And I think you get a haircut because you want to look good. You pay more money to go to a certain stylist. So I think it's a natural evolution.
I've had a number of attorneys, litigators, who want to have facelifts so the juries take them seriously. I've had principals and school teachers come in for facelifts because they want to be perceived as young, so their students take them seriously.
If you look like an old guy, you might have old ideas. If you look like a young, youthful guy, then age won't necessarily be a factor.
We know that attractive people do better in their environment. We know they get the best jobs, they get the promotions, they make the most money, and people want to look the very best they can.